Welcome to Deciphering Growth, the show that explores mental health from every angle. We bring you conversations with personal opinions, stories, and practical tips. We aim to break down the stigma and help you live your best life. So please sit back and let's dive in. Before we begin, we want to remind our listeners that this podcast represents the opinions of Tiffany Graves, Eric Stone, and the show's guests. The content here should not be used as medical advice. It is for informational purposes only, and please consult your healthcare professional for any medical questions. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast should not be in any legal capacity whatsoever, including but not limited to establishing a standard of care in a legal sense or as a basis for expert witness testimony. There is no guarantee regarding the accuracy of any statements or opinions made on the podcast. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship.
Well, hello, Tiffany. How are you doing today?
I'm doing good. I'm doing good, despite the impending cold that is
Gosh,
coming.
it's that classic. Do you turn to heat? Do you turn to air? Do you turn to your favorite blankets? It's quite the dilemma.
Yes, I don't like it. It's not cool. I'm ready for summer again.
I am ready for 50 degrees to just be a permanent thing. That would be great. Not why we're all here, but that's my soapbox I won't get on. But I was really excited getting to kind of talk with you about anxiety last time, and I felt like there
Mhm.
was a lot of really interesting just insights and things we were talking about a little bit. And I don't know about you, but it's been really fun. I've had some of my colleagues listening to this, had some family and friends, and it's been very interesting to hear their thoughts on what we talked about last time. So I don't know if you've gotten some of the similar things than what have happened for me.
Yeah, I've gotten some prodding questions of like, when's the next episode? When are you gonna keep releasing more? And I'm like, patience, guys, patience.
So much pressure to just record us talking, and you and I love to talk. So no, I think the plan as of now is to shoot for every other week releasing something, and we're really proud of this name, but the neurobites, the mini ones, I really feel like that's my proudest thing we've come up with so far is the neurobites for
Yes.
some neuroscience with the background. So yeah, so definitely not. We'll probably come back to these topics like anxiety and depression for sure, but this is our first just getting it going, just kind of putting some things out there to talk about. So I know the theme for today is depression and talking about it and getting going. And so Tiffany, what maybe just starting out, how would you define depression?
Ooh. So depression, I can't, there's really no better way to explain it than the YouTube video of the big black dog. I don't know if you've seen
Mm,
that, but it's
I
just
haven't seen.
this really big dog that follows this individual around and kind of like smothers his experience. And as he learns to cope and deal with depression, the dog becomes, more of a dog size, more manageable, and he learns to live with the dog and live with depression. And it's a really good metaphor of like how like depression can be really big sometimes and really manageable at other times, but it never really truly goes away as like we are humans, we will experience intermittent bouts of depression.
I wish everyone could have seen my face because my jaw like dropped as Tiffany described the video. I have never seen this video. It sounds really amazing, and I'm glad you have a good video because if you Google what is depression, like the word depression is in the name. It's like feeling persistently depressed or a group of conditions with a lowering in mood, such as depression. It's like, how can you understand something when the definition of something has the word in it? Uh,
Yeah,
so yeah, I,
that's
I would, yeah, it's challenging.
it's one thing that frustrates me about the English language. Let's define terms with the term.
Yeah, I like this one just to throw it out at the beginning. Persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. There are many different symptoms we could add, but I think just knowing like how we're describing it. I know that we're not going to do this, but just for people who are just now listening, we are not going to tell you today if you feel depressed that you need to go outside, take a walk, and that is all you need to manage your depression. That is a load of bullshit. That is not helpful. I cannot count how many clients have been told that before, how hurtful that has been, how deeply unproductive that is. So, Tiffany, have you had clients have this experience of being told, like, just go for a walk, you'll be fine, go outside?
Yeah, or I think the one that frustrates me the most deeply is when I have clients tell me that the people around them tell them they're lazy, and it's an excuse for them not
Oh,
to want to go do something. And I'm like, I'm glad I
oh,
don't know or I legally can't come to where you live because I would put on some boxing gloves and get arrested for this. It
it
just,
is. It's like I mean it's something we're very passionate about. Like I have tears in my eyes as we're talking about this because it's so hurtful to be told that. And I don't even think that would be funny as like if a stand-up comedian said these things, but like for someone to actually say that to another human being and genuinely believe it and mean it, like the damage that that does to a person, especially when that's a person you may feel like you need to lean on for support. It's almost like them saying, "Hey, you will never be uh, a safe person for me to talk with about my mental health struggles with depression."
yeah. And not only that, it construes the message that I don't give a shit about you. I don't give a shit about your struggles. Like, put on your big boy girl pants and like just fucking do the thing.
Yeah, yeah, it is. It's not helpful, and I think it's so deeply insulting to imply that anyone struggling with depression, it's just a lack of willpower or decision making. Like I have met at this point thousands of people that if they could literally just choose to not be depressed, they would make that choice a million out of a million times. It is not something they are choosing to feel that way. And just I mean it's just I don't know. I think it just lets me know how ignorant someone is, or that they have never had to hopefully never sit with someone dealing with depression, because to have ideas and beliefs like that and have encountered it, I'm like, that is so problematic. May they never know the pain of losing a friend, losing a family member, losing a client, struggling with depression. It is a vindictive, cruel thing I wouldn't wish on anyone.
Yeah. And it really shows a lack of empathy and compassion in that person that they can't just sit with another individual and be like, these are your valid emotions, let's figure out how to work through this together. And I hear you versus like, you're just being lazy.
Yeah, and so it's good to know what not to do, I think, and I think we both have some very high passions about this, rightfully so, because we know the impact of that. But how should someone support someone with dealing with depression? Like how can I, as a friend, as a partner, as a father, how could I help someone dealing with depression?
Yeah. So I always encourage people that have, individuals struggling with depression in their life to celebrate the little things. Like if your friend reaches out and says, "Hey, like I think I want to meet up for 5 minutes," or even if it just turns out being 5 minutes, saying, "Hey, thank you. Like I appreciate you coming out. Like this was really courageous of you and supporting them." If they wake up and said, "Oh, I managed to shower today," so that's great. Like that's a step in the right direction and helping support those individuals that any little change that they make is progress. It doesn't have to be huge, significant things.
Yeah. What if I'm really worried about, like, what if I'm so worried about my loved one or friends and I'm like worried if they're safe? Like what should I do if I'm worried about that?
Yeah, so if you're worried about safety, create a safety plan with them, encourage them to seek professional help. If you're to the point to where you think they're at risk of harming themselves, invite them to come to the ER with you, invite them to go to a safe space with you. If you're able to, have them stay with you for a couple days. Just try and be as supportive as possible while making sure they have the resources, the crisis hotline, the crisis text line, things of that nature to help support them in that really dark time.
Yeah, I think even as therapists, we obviously know people in our personal lives that deal with depression, and it's something that like we're not able to do it differently. Like we would have to do the same thing if there was someone in our family doing the same thing, making sure we offer that support, that needed space, those outlets, those uh, pieces. I think just like listening to the help they're asking for is really important. I think sometimes people feel very stepped over, like they don't need people with depression don't need a superhero to come in and save the day. They need their dignity respected. They need support. And so like, sometimes I've needed help with something. I can think of all the teachers that made me feel so small for needing help, or when people offered help and then punish you for it. Like that is not what someone struggling with depression needs. I would highly encourage individuals to ask them, "How can I help you? What would help you today, or what's something I can help you with?" And uh, that will be, I think, a very helpful piece.
Yeah. I think because I'm a very visual person, I like to do the metaphors. I always encourage people with the metaphor of like giving them flowers. Like imagine yourself handing that person flowers. That flowers represents your support. Um, you can't force those flowers on that person, but they're there. If they take the choice to take them and choose your support, then it's there. Otherwise, it's still extended. It's still there to accept it when they're ready.
It's always something. It's always something. And I think it's something to know, like, it's not personal if someone doesn't want the help that you are offering. Like, respect that someone is using their energy to tell you what they do or do not want. Like, that's a hard step sometimes for a lot of people as well.
Yeah.
Hmm. So, what should we do for folks who are feeling depressed? Like, so we've talked about like what not to do if you're a caregiver, what to do. Like, what should someone who's feeling depressed maybe start with?
So I would encourage them to focus on the little things. So combing your hair, taking a shower, brushing your teeth, dressing up, even if you're not going out, dressing up into something that makes you feel good. Doing one little chore around the house, reading a book, something that like gets you up and going versus like beating yourself up about not doing anything. Even if you can just do one little thing, that's one thing that you can challenge that negative thought pattern and be like, well, I did shower today, so I did something.
Yeah. I think remembering that it doesn't last forever, that the depths of that wave of depression, and not allowing what you feel in the lowest point be the last point you check in with yourself about what you're feeling or noticing. Uh, because we can feel a lot of things like, hey, I need to, move to a different place, or I need to go on Amazon and I need to hurt myself to feel safe. Like though their feelings can tell us some things, but they obviously do not come up with the right answer. And the answer to hurt ourselves is never the solution to what we're experiencing with depression.
Yeah. And sometimes it can feel that is our only option. That is the only way to experience feelings again. Some people can get so numb. It's important to recognize that like it's not shameful. Like everyone has those suicidal thoughts, those self-harm thoughts. Some people engage in the self-harm, and self-harm is just a coping skill. It's not a healthy coping skill, but it's a coping skill that an
Mm,
individual has adopted that is helping them in some form or fashion.
yeah, shame is not the solution to changing any behaviors. It's certainly not. So we should celebrate survivors. We should help support people as best we can. And I think it's one of those things that people, yeah, I think it's come a long way in the past maybe 4 to 5 years of how we talk about this, how we support things, how we provide like just lots of different things. But there's still certainly room to improve in like how people get connected to services and how we support them as friends and family members.
Hmm. Yeah. So something that commonly frustrates me, and I'm curious if you've encountered this or heard this, that men in general or more likely to be depressed, but less likely to speak up about their experiences.
Oh yeah. I mean, every male client I've ever had, I'll joke with them about like if you fell and scraped your knee at a sports practice, like what were you told? And a lot of them are like, put some dirt on it. But usually the second one is like, man up. And this idea of like, what does that even mean? And normally it means don't cry, or whatever it is, almost that those feelings are like a weakness, something that need to be like solved. When reality, I obviously there's this stereotype of women being much better with feelings, and generally that holds up a lot of the time. Higher emotional intelligence, I would say the research says that's because women traditionally are getting more time to practice developing those skills and getting to feel things and getting to work through them, versus some upbringings, not all men, aren't getting the chance to practice building those skills. So then you get to a point where it's overwhelming, where maybe you are feeling depressed, and it's hard to know that that's what that is.
Yeah. And something I want to add to that is depression looks extremely different in men versus women. Men can be very irritable, angry, explosive, restless, versus like women can be sad, fatigued,
Yeah,
struggling to interact on a social level. So keep in mind, like it might look different, like if you're a
yeah,
male than a female if you're feeling depressed. And because of the lack of opportunities that males have to explore those emotions, they might just think, oh, I have an anger management problem, which might
yeah.
not be the case.
Well, it's easier to feel what you know, and if you're taught that that's a permissible feeling to feel anger, we could have a whole podcast series on this. We're not. This is our one and only, for me at least. But men are allowed to feel anger. Like that's a permissible
Hmm.
feeling. I drive, someone's on my tail. People would think that's funny. I could make a joke right now about road rage, like, oh, that's hilarious. Eric gets angry when someone rides his butt. Like, but if I were to like maybe start crying on this podcast, some people may be listening to that, like, oh my gosh, what's this? Is that all what all male therapists are like? They just cry on podcasts? Like they would feel something.
Hmm.
And it's just interesting, isn't it? Like what is allowed? I'm putting air quotes. What is allowed? What is permissible? What is not? But so many men know what anger feels like, know the shades of it. But that is a secondary emotion most of the time. Like there's probably a time if someone's threatening your child, or a bear comes in and you're like, I gotta go. Like that is probably anger is probably the primary, right? But oftentimes anger shows up, but underneath it's pain, underneath its vulnerability. Uh, yeah. And
Yeah.
so we don't want to shame that, but it's like I definitely think there's a lot there that we could talk about with men mental health. All genders mental health are important, but yeah, if we're talking about mental health for males, there's a lot. Again, things are getting better, like we're having a podcast talking about it, people are maybe listening to this and going, but there's a lot of needs there to improve overall.
Yeah. And we can always dive into that further in a different podcast because, I strongly advocate for males seeking appropriate therapy as
Yeah,
needed. But
I think
yeah,
it's a great idea. I think that's one I think we should definitely, we'll follow up on a lot of these, but maybe that's something we can follow up with, just because I think there is a need uh, for improvement there and understanding. And so I love what you're saying though, that there's differences, and just even like and if you're a female and you're like, well, my depression sounds more like male depression. Like there's just some stereotypes, which is just from the data of like how things are showing up presenting. That doesn't mean how it presents for you. And I
mm-hmm,
have to throw this out there. Like, please do not go on TikTok and watch a video and then you hear that because you were burnout with your kids because they've been so difficult this week, then it's like I feel depressed. Like you definitely are feeling some emotions, but that doesn't mean you have depression. And there are some really wonderful resources. Tiffany knows I love my TikTok videos, but self-diagnosis, like I am as a licensed clinician, cannot self-diagnose myself. Like I cannot do that. I have to go to therapy and have someone else do that. That there's a reason that's the thing, and it's because we are all biased human beings. And so if you're watching a bunch of videos, like, oh my gosh, this is just I don't know, Tiffany, for you, but when like I took some of my counseling classes, every class I'm like, oh my gosh, is this me? And like most therapists have that feeling, and it's like it's not meant to be a, I don't know. I just think we have to keep that perspective, like what are we giving attention to? And all of us are going to have some shades of these feelings, and that is normal. It's when it gets to that level of, oh, I'm not safe. Oh, I
Hmm.
can't function. That's what we're talking about. Just I have to throw that out there. I don't want anyone listening to this of like, oh, well, I feel down sometimes, and it's
Yeah.
just
And that kind of leads me into one of the common myths that I wrote down to talk about is that depression is just a deeper form of sadness. And it's true, but not true. Like, yes, depression can feel very overwhelmingly similar to sadness, but it's not the same. Like, you're really sad when you like get the wrong order at McDonald's. You're like, oh shit, like that sucks. Sad.
mm,
Or even potentially angry. Depression is more of a prolonged
yes,
state that just is characterized by negative thought patterns, self oh, what's the word I'm looking for? Self-defeating, self-defeating thought patterns and things of that nature, where you're just essentially being your own punching bag inside of your brain, and that keeps you
yeah.
from like moving forward.
Yeah, I have used this phrase or analogy of like you feel like you're doing 10 rounds of Mike Tyson, like to
Yes.
yourself, like you don't need anyone to come in and say, like how can your room look like this or why have you not like it's like, oh, like I like I don't know. There may be someone, maybe we'll hear from them, someone who that helped their depression and that kicked them out. But I would say that is not an approach most people respond very well to. I just think everyone says, well, I know one person. It's like, well,
They're an
out of how
anomaly.
many? Out of how many people are you talking to? It's like if it's 1 out of 1,000 or something, like maybe we don't like lead with that. Like I know in my own therapy, if that was the approach I have gotten, if I would have gotten, I would have been no, there's no
We would have been
that's not,
fired a long time ago.
oh my gosh. Yeah. It's just yeah, so I think just knowing like when is it a time to seek therapy is when you notice it impacting the quality of your life, day-to-day functioning, and
Hmm.
maybe people around you are kind of noticing, and it's okay to ask for help. Like it is genuinely okay to not be okay. I hope we say this every podcast. I'm going to try to remember it, but almost no one goes to therapy for life. Very few people need therapy permanently on an ongoing basis. So typically, what happens is people go to therapy for seasons and they have certain things that they want to get done. They work to get those goals. Very important to point out 4 to 6 sessions, you should see some improvement in therapy. I'm not saying resolves all things, but in 4 to 6 sessions, you should see some improvement in something. And if not, you should talk with your therapist about that of like, hey, like I'm still noticing this, or this is not maybe what I'm looking for. That's a great conversation.
Yeah,
Therapists want to have that conversation with you.
for sure. Yeah, we want to make sure that you're achieving what you want out of therapy and not wasting your time.
Yeah. And I think this is one of my favorite myths that we don't care that our us as therapists, we just are in it to make a bunch of money and to, just keep our schedule full. And it's better for us if like we just have people coming in every week for life and that's what we want to do. I know no therapist doing this work that wants a client to permanently see them forever. Like we are
Yeah.
ethically and legally obligated not to do that. We are to build independence, build those skills, and there is nothing more rewarding than seeing a client get to that point. Yes, we are paid to do this work, just like a plumber is paid to come to my house and fix my plumbing when I need some help. So, yes, are we paid? Yes. Are we in this because we are paid as well as every other profession? No, we are not. We're here
No.
because we are passionate. Tiffany's face when I said
I
that.
know. It
We
just took
are,
me back to grad school, and the very first statement one
oh,
of my teachers made is, "If you're here for money, you need to walk out the door right now."
yeah, and that doesn't mean that I hope that their mental health is taken more seriously and continued and compensated well so that there's more access to care and things. But in this current season, no, very few therapists are just driving in like Porsches and have like 3 homes and things like that's not what we're doing. We are doing this work because we care. We usually have a reason we're personally connected to mental health, whether that's a friend, a family, or personal experience, and we want to see it go. So that I should get. I'm not trying to get all spicy, but that's something that drives me crazy. Of like this idea of like I want people to come see me and then never leave. That would literally break my heart if my clients were not leaving. It
That'd
would,
feel really icky.
yeah. And just to encourage people, like when us therapist folks hear that other therapists are doing that, we have an obligation to let that be known. And that is like we are here to protect the clients, all people. We want it to be high quality. We want to be a hard science. We want it to be helpful. So I don't mean to get all spicy. I think I kept it PG, but that's something I'm like, no, like I want my clients to come, get what they want, and leave because that's a high quality experience and that is going to change your life. And if I'm not doing that, then I'm not very good at my job.
Yeah, no, and like I love my clients deeply, but at the end of the day, like I don't want you to fucking come back unless it's like another goal that you want to work on.
Yeah, we say very similar things. Like I was just discharging some people, and it's like, hey, if you come back, if you need therapy again, please feel free to reach out. But I set out to accomplish what brought them in, so
Hmm.
that we are knocking that out. And if a new shade or layer of that comes up, that is different. But if it's the same exact issue, and the same exact way, then like I may not be on my game, and I need to reevaluate what I'm doing. Um,
Yeah.
I think just the other thing of going is like, oh, it'll pass, or oh, like this is fine. Like sometimes feelings of depression can pass, but if you've noticed it sticking around for more than like a few weeks to months, like that's probably a time to kind of check. All of the things we do in therapy are more helpful the sooner we are able to get involved with it. Waiting for it to get to like an emergency degree is not as helpful. Kind of like if I don't have any injuries at the moment, but if like my shoulder is tearing every day, waiting for it to be like completely torn before I'm willing to go in and get the surgery. Like I think a doctor would tackle me if I tried to do that. Maybe not, but
Yeah. Well, and that's the analogy, well, not that exact analogy, but analogy that I kind of use with my clients is it's like if you had a rash or a third-degree burn, you're not going to go, "Oh, it's totally fine," and just go about your life until it's gangrene infected and you're like, "Oh yeah, this has to be amputated now." Like at some point you're going to be like, "I probably should take care of this."
yeah, yeah. And do you have any other myths that you wanted to go over?
So yeah, there was another one that I kind of wanted to see your thoughts on. Depression is just a form of self-pity. How do you feel about that one?
Can you say it one more time? Because I feel like I need to take that in.
Yeah, so a myth that I found is depression is just another form of self-pity.
Like gathering my thoughts. I love that we do this live because we're getting real reactions. So this is, I think that keeps it interesting. Depression's that I think that's bullshit. I don't think that's true at
Yeah.
all. I think it can look like that maybe, but no, depression is like it can be chemical, it can be social, it can be trauma that has just kept sticking around. No, I no, I don't think that's pity. I think like I mean, maybe so. I don't know. Yeah, I don't even agree with that. I don't even know how to like approach that because it's like I've never framed it that way. I don't think it has any validity to that idea. I had to take a second because I found myself offended by the statement, I guess, because it's like, oh yeah, it's just self-pity. It's like just was like another way of saying like depression is a choice and you should choose better. And it's like that's not true. That's not true. I If that were the case, I could meet with someone for 5 minutes, say, hey, don't be depressed. And they're like, oh my God, I'm cured. Thank you. That is so helpful. Like that is not what is happening. That is not how you treat, manage, and support someone with depression. But I'm curious what your thoughts are because you're the one that
Yeah. So I'm not a big social media consumer, but I'm very aware that like our culture, our society as a whole has an admiration for power and quote unquote mental toughness And anytime that someone falls outside of that cookie cutter mold, we're very quickly stamp them as a whiner or lazy or just like unwilling. Um, so this is a very culturally driven myth in that, you know, it can get skewed as someone having depression can be looked as upon weak or a whiner, and it's like really you don't know what this person's going through. You're so quick to label them just based on these overarching ideas that you've been led to believe that probably haven't even taken the time to see if they're valid overarching beliefs. And you're just rubber stamping them on anyone that matches it, and it's like you're just stamping harm on every person that you meet and that you encounter and you engage with in that manner.
Mm, yeah, I love that. Man, Tiffany's just got some depth today, y'all. I'm sitting, it's like I feel like I'm going to like a session, just like, okay, like yeah, I need to like do the homework. Okay. I feel like, yeah, like when I went to the dentist last week and they were like, we need you to floss. I'm like, I'll floss, I will. I need to learn. Yeah, I just think there's so much misinformation out there, and hopefully this just clears up like some pieces. And I just want to throw out a very shameless plug for all of the mothers out there. This like mom guilt thing is such a thing, and maternal mental health is so important. It's important for like parenting, it's important for like relationships, but it is something that I think there's obviously that's been a thing, but I think there's getting more and more recognition. So just shout out to anyone that is like postpartum or feeling some of these feelings of depression. That doesn't last forever either. And it's okay to need help. Like you are not a bad mom if you need
Yeah,
therapy to manage some of those feelings like
yeah,
that. There's nothing bad about you doing that. That is how you're like supporting um,
yeah.
yourself so you can support your family.
Yeah, and just to add on to that, normalizing that postpartum experience, like your body just gave life to a whole nother human, and it was a traumatic experience for your body physically and mentally. And it's okay to take the time to grieve what your body just went through while
Mm,
also taking care of this newborn life. Like it's a very complex, complicated transition for mothers.
yeah. Yeah, it's not easy, to say the least, and I think something yeah, just I know we've talked about, mental health is very important. I just was thinking too, like, that is a very common thing. I'm just thinking about all the new moms during COVID, really being a new mom anytime, but just during COVID where it's like you felt like you can't even leave your house at all and, like, what's going on? And just I know we saw so many people dealing with those type of situations, but also just right now as it's about to get cold again and okay, I'm not really able to go everywhere and like what do I do? And just
Yeah.
knowing like, it's okay to not be okay and it's okay to need support. Like needing additional support is not a weakness. I have joked with clients before, like I haven't made the fibers that have sewn my shirt together. I did not make my shoes. I have not, sourced my coffee to the bean, to the root, to the tree, like it's like, how far do we take this that I have to be independent and don't need anyone's help? Like, how far
Hmm.
do we take that?
Yeah. One last thing I want to touch on to kind of normalize for those out there that might be dealing with depression or in therapy for depression is the fact that having depression means you're on drugs for life. That's a load of it's a dump truck load of bullshit.
Yeah, yeah, yeah. It's a tool that can
Hmm.
be used again, like therapy for a season. Uh, I know there we're just planning all these other episodes. I feel like meds and therapy could be its own series as well. Um, but people tend to get really strong feelings about that and like not needing it or how they use it. And it's a personal decision, but I think the shame around it, I don't resonate with at all. I'm a substance use counselor and I've had many clients uh, maybe feel shamed for like the different medications they were taking to manage their recovery or manage their mental health. And I think like, how dare you? That's how someone is alive and here and like if taking medications is what you need to be alive and live your life, then like who cares what everyone has to say about that?
Yeah. Well, and just to add to that, like, tell them to fuck off. It's not their business. Like, no, like, it's no one's business what medications that you're taking or what practices you're using to help you reach your biggest and best potential in your life's journey.
Mm, yeah, that's a decision that should be up between you and your doctor and your, just yeah, it's what you know your body best, and that is awesome. And also we need, those folks that know all those interactions of medications and what's going on. But yeah, like they're it's so interesting when you said that because it's like, yeah, there's just so many things out there that can stop someone. And so yeah, take care of yourselves. Take care of yourselves how you need. I just went to the dentist. They didn't shame me because I didn't floss enough, like, oh man, you didn't floss good enough. So we gotta like help you out with that. Like, why should depression be any different than that? Of oh, I went and I needed to do this or that. Like, why should we judge it differently? It's a medical thing. It's not one is mental health, one is dental, but it's still a medical procedure with an intervention to take care of something. Like, why should one carry a stigma and the other be like, oh, okay, cool.
Yeah. And I don't want to get too much into the neurology, although that is I love the neurology. But I think sometimes people forget that your brain is a physical organ in your body that manages your entire body on a 24/7 basis while also producing thoughts and helping you like converse and interact and do your job and things. So it's doing two full-time jobs 24/7 for you, so why would you not want to take the time to give it extra care when it's struggling to do those two full-time jobs?
Mm, mm. I think I read the stat was yesterday. 47% of people who need to go to therapy or 43% do not ever get
Mhm.
the therapy, which is a huge number. Like, I mean, I had to fathom, I was like, that would mean like half the people who need to come do not. And that was, I mean, it's just such a big number. It's not like a, oh, five, it's a huge number of people that are never coming to therapy in any form or fashion because of whatever the reason may be.
Yeah.
So I think therapy is for everyone. I think we have to find the right fit of therapy for everyone when there is a need. Um, I think a goal for this is to increase trust in therapists, understand some of the processes of what we're thinking, why we're doing things, and to hopefully just allow folks to make informed decisions with their mental health care. Um, I know that's what kind of got us into this a little bit, but anything else you have, Tiffany, as we're winding down?
Yeah, no, I think you be confident in what you want and don't hesitate to not see a therapist or choose a therapist because they are what you need. Like there'll be times when you're like, "Oh, this therapist has this one thing that they work on," but reading their bio, I'm like, I don't know if I want to work with it. But you read someone else who maybe it doesn't specifically say that they work with depression, but you really jive with them. Don't hesitate to give them a call. Most therapists can work with general concerns such as anxiety and depression. You might be surprised that just that simple phone call, how well you guys do jive or you don't jive.
Yeah. Well, thanks, Tiffany. I'm grateful to have sat in this conversation with you. I feel like even though it's our podcast, I'm learning things with you.
Yeah, yeah, it's always fun to sit and have these conversations and kind of rattle my brain a little bit too and learn and grow and continue on that never-ending growth journey.
Thanks for tuning in to this week's episode of Deciphering Growth. We hope you found our conversation helpful and insightful. Growth is a journey. Taking it one step at a time is okay. If you've enjoyed this episode, subscribe to our podcast so you never miss an episode. If you have any questions or comments, don't hesitate to contact us on social media. We love to hear from you. Until next time, keep growing.